everybody. Nice to be here. My name is Dr. Michael Gorman. I've met many of you before. This is Dr. Zack Bohr. We're with IMove PT. We're both physical therapists. And very grateful for being here. We always have a great time when we come. We like to have a lot of fun, and but teach you at the same time. So a couple months ago, Beth and I were texting back and forth, and we were talking about what this topic could be. Because last time we were here in June, we were talking about our electrical stimulation unit called the Newbie, and it was fantastic. And so we were just trying to figure out what to do. And she said that a lot of people ask her how should they sleep, what kind of position is best to sleep in. And I thought, well, that could be an interesting topic. And the thing is, there's no... Is this better? Oh, sorry. You want me to start over? Okay. So I thought it'd be good to bring a table in and actually demonstrate, because there's no probably one best way to sleep. But we're going to talk through the three main ways that a person sleeps, and what we talk about each and every day with every patient. And so you guys will see this, and let's keep it informal, so please ask questions as we go along. But I have a slide here, just some fun facts, okay? Well, we know that sleep needs vary. We know that average is about 8 hours a night. That's what they always say. Personally, I get 6 hours of sleep, and even on weekends when I could sleep in, I don't. And I'm fine. I mean, I feel like I get plenty of sleep. Some people need 10. So it just varies. I don't buy you got to have 8 hours, but I think if you start getting lower than 6 or 5 hours, I think then that becomes a little bit of a problem, because your body heals itself when you're sleeping. Sleeping is very active. Again, it's some parts of your brain use more oxygen when you're sleeping than when you're awake. Okay? The first 3 hours, so this I learned this, and to me it was very interesting. The first 3 hours of sleep is your deep sleep. I guess I was thinking that maybe your deeper sleep came as you slept for a longer period of time, but first 3 hours of deep sleep, and the REM sleep, the rapid eye movement where you see your partner's eyes going back and forth, and your dreams occur later. So if you're not getting good continual sleep, like how many people in this room never get a full night's sleep because they have to go to the bathroom? He doesn't know what I'm talking about. She doesn't know yet, but they will. Once you reach 50, things change a little bit. But so if you're getting up every 2 or 3 hours because you have to go to the bathroom or because of pain, then you're never really getting into that. Maybe you're getting a little bit of deep sleep, but you're definitely not getting in that REM sleep or where your dreams are really occurring. So, some things we can help and some things not, but not getting sleep is so vital. It's just a huge issue. Some fun facts. The first one, 11 days and 25 minutes. There was a high schooler in 1964 he stayed awake for 11 days and 25 minutes without getting sleep. So that apparently is a world record for the longest period of time. I don't recommend that for anyone. Elephants only sleep about 3 hours a day. Koala bears, 18 to 22 hours a day they are sleeping. That's probably why they're such cute animals. I don't know, maybe. We all have dreams. Some people say, well, I don't dream. Let's just say you don't remember them, or but you dream about 4 to 6 per night, okay? Who has dreams that wake them up? I do, yeah, okay. Okay, we should all do what kindergartners do. We should take an afternoon siesta, okay? But not too long, because if it's too long, you'll wake up groggy. So they say 20 to 30 minutes is a good siesta, okay? And then I found this last fact to be interesting. 75% of us dream in color, but before color TV was invented, only 15% dreamed. Now, I have no idea how they found that fact out, but I thought that was interesting. So a lot of fun things about sleep, but it's just vital.
right, so some general tips about sleeping. It's really important to rotate your mattress about every 6 months.
Yeah, probably every 6 months. How many people rotate their mattress? Awesome.
Good.
How often do you guys do it?
Can't remember.
But it's pretty important so you don't continuously sleep in the same spot and create a crater in your bed, especially if you and your partner are different weights or sizes. That way you're evening out the mattress. Also limiting your caffeine from late afternoon on, or else you'll have trouble falling asleep. And then how you start the night may not be how you end up in the night. So these sleep positions we'll talk about, they're great ways to start the night, but as many people move throughout the night, so you may not actually wake up in that same position. And then to make sure you buy good pillows, make sure you get new pillows once your pillows are worn out, or else they're not really giving you the support you need.
Yeah. And even though we may show you how to sleep, sleep is so variable, and I strongly feel it, and I have no scientific study to back this up, but I feel like it's how you sleep is how you were in the womb, and how you were, because some people sleep in such weird ways, and I try to get them to change, and they can't. So we're going to show you, and it may help you, it may not. Okay? All right, so what happens if you say, well, I like to sleep on my back? Well, that's good. Sleeping on your back is good. We have some pictures we're going to show you, and we're going to demo this, but Zach, you want to talk about this?
Yep. So lying on your back is great for low back pain, neck pain, and shoulder pain. 1, 2, or more pillows underneath your knees helps give your back some relief. I know also, like for me, I move around a lot throughout the night, so it'd be hard for me to keep 2 pillows underneath my knees through the whole night, but it's a good way to start sleeping. A pillow underneath your head to keep your head in neutral position, and then a towel roll or a pillow under your arm, or if you have a painful shoulder, then underneath that shoulder.
Yeah, so just a couple things here. Why the pillows underneath the knees is so important is when we lay flat on our back, what happens is that your lower back actually arches or extends, especially if the muscles like in your hip are real tight. It's going to cause your lower back to arch. And if you have stenosis, you don't want that back to arch because you're going to close the holes down that are already closed down more when you arch your back. So this right here is really a nice way to think about it. Just kind of, as Zack said, kind of flattening that lower back out a little bit. And then when we talk about keeping your head neutral, that just means we want your head and neck to be straight. We don't want you to be like extended back or flexed forward or tipped over. We just want, and sometimes you need 2 pillows. And that's why I said invest in stock pillows, because you're going to probably need a couple, and you're going to see how we do it here.
And if you have too many pillows and bring your head too far forward, then you won't be in that neutral position.
Mm-hmm. Absolutely. All right, so Zach will just show you this. I'll be your patient. Is this stable? Okay, good. Should be. And maybe just talk about the pillow underneath that support if you have a bad shoulder.
Yeah, so the pillow under the shoulder in the picture here is if you have shoulder issues or anything to keep your arm in this position, versus if you don't have a pillow underneath it, it's going to be past neutral a little bit. So if you have a painful shoulder or arm, that just gives it a little extra support.
So this is not good if I have back issues, because my lower back right now, I can feel it's arching. So Zach's going to do this. Oh, so much better.
Yep, and then that flattens his back out. He's good. And then his head's in a neutral position. You see it lined up, where if he had another pillow, he would be too far flexed. If he had no pillows, he'd be too far extended the opposite way.
And one pillow is probably not enough. Talk about that. One is maybe
Under your legs. Yeah, one underneath the legs. Here, if we take one out, and then we'll come back down. That doesn't give him enough support. You see how this is flattening out with just the weight from his legs. And it will vary a little pillow to pillow, and if you have a firm pillow, like a memory foam pillow, or more of like the hotel style where they're thinner.
All right. All right, who likes to sleep on their side? Okay. Who likes to sleep in many positions? Who can only sleep in one position? Yeah. Is that on your back or your side? Side. Yeah.
Same side.
Yeah. I think that I feel like most people in my career have talked about most are side sleepers. Yeah. I can't do that. Okay. So sleep on your side. Well, guess what? It's still good for if you have back pain, neck pain, or shoulder pain. It's still good. Same applies. We want you to put a pillow in between your knees when you're on your side. That will give you better spinal alignment and keep your hips neutral. Pillow under head to keep it neutral. Again, we don't want you tipped to one side or the other. And again, if you have a painful shoulder, putting your arm up on a pillow is helpful to give it support. So your arm's not just going wherever it wants to. And more pictures here. So, okay. So Zach will lay on your right side. All right. So let's say he's on his side, and we like knees to be flexed up a little bit. You can see he's got maybe a 60-degree bend or something like that. And this can be also good if you have spinal stenosis. Again, you're kind of flexing your spine open. When you have stenosis, it doesn't like prolonged walking. It doesn't like prolonged standing. It's great with sitting, but you need to flex out to open the spine up a little bit. You want this pillow so he's neutral. We don't want him flexed up like here, because then that jams up the left side of his neck. And we don't want him like here, because then he's tipped the other side. So neutral is good. Okay? And then pillow in between his knees. Also, if you have bony knees, this is beautiful. Okay? That's a good thing right there. And then the other thing is if Zach has a painful left shoulder, I like doing this, and I like to maybe fold the pillow up so he's like that. Do I think he'll stay like this for 6, 7, 8 hours? I doubt it. But one other thing, I don't have a picture up here, and I didn't bring enough pillows, but I oftentimes will tell a patient if I don't want them, let's say we don't want Zach, let's say Zach says, I am a side sleeper. That's the only way I can sleep. I'm going to toss and turn. I'm going to be on my right or left. Well, what I can do is I could either put a dog behind him, if he has a dog. If he has a spouse or partner, could be behind him. Or the best thing to do is put a pillow behind Zach. So if I put a pillow behind Zach, he tries to roll, that pillow's going to block him. So if someone has a painful left shoulder, I don't want them to lay on it. I don't want them to compress it. So let's just put a pillow here to block him. And again, will he stay like that all night? I don't know. But at least if he tries to roll, it's going to stop him from doing it. Okay? Any other things that were sidelined? Okay? So let's show you one more, and then we'll kind of answer some questions, okay? So I like to sleep on my stomach. Who here sleeps on their stomach? Ugh. Oh, man. Okay. My wife sleeps on her stomach, and I never understand it. And I cringe every morning when I get up, because I get up way before her. So I see that. Okay. So I have right here, is this great for low back pain, neck pain, and shoulder pain? Not really, but if you're going to do it, I would definitely encourage you to use a pillow underneath your stomach. Why? Because when we're laying flat, again, the lower spine arches. Okay? When I have a patient in the clinic and our Zack sees a patient and he's working on their lower back, I like putting this pillow here because that will flex their spine and be a little bit more comfortable than the lower spine sagging down. Pillow underneath the feet is nice. But what are you going to do with the head? That's a problem. Because who here has a stiff neck? No one? No one has a stiff neck? wow, you guys are great, healthy, great. Well, if you have a stiff neck, you're going to have a hard time laying on your stomach, because what are you going to do with your head? I don't know. So a couple options we have here is these two on the right side is probably the best. But who can sleep for 6, 7, 8 hours with their forehead up on a towel roll? No one, probably. And who can sleep with their forehead on your forearms or hands like this? Probably not too many people. So we wind up doing this, which really not too great for your neck, because we talked about keeping your neck neutral. But again, some people, this is the only way they can sleep. So.
How do you feel like that?
I mean, I couldn't do this for very long, but I definitely, like, this is not very comfortable to me, nor do I think it's good for your neck.
Yeah.
But some people do it.
Yeah, one of the issues is you're going to be rotated to the same side for however many hours you can stay in that position. So you tighten up one side of your neck, loosen the other side. So if you did it, I guess alternating which way you turned your head would be good. That way you're not tight on one side every single night and then stretching the other side the entire night.
Yeah.
And it's kind of hard for your shoulders to stay in this position for that long of a time as well if you were doing like this example.
I guess you could always get, talking about, like, you get a bed that has a cutout, like our tables with the headrest.
Yeah, unless you had a cutout like some massage tables have, and then your head could be in a neutral position.
I don't know how else you could do it.
Yeah. And that's like the only way you'd actually be able to keep it neutral.
Yeah, I don't know. I think it's tough, but again, sleeping is a variable thing. We can't tell you you have to sleep like this, because that would never work. So we got to work with the patient to what they could actually tolerate, or what they prefer. Okay. So who has sleep apnea? Only a couple. I bet a few of you may have and you don't know it. So my story is this was 2018. I was coming back. I was constantly tired, even though I fall asleep quickly. But I was coming back from a golf trip. I was not driving, but I was sitting in the passenger seat, and it was 2 o'clock in the afternoon, and I fell asleep sitting up, and I gasped. You know what that gasp is, when you're like almost choking? At that point in time, I knew something was really not right, so I got a sleep study about a month after that, and I had 25 breathing interruptions per hour. What that means is, for 10 seconds or more, 25 times an hour, my breathing was stopped. So think about like the lack of oxygen getting to the brain and just to the rest of the body, and that's only moderate. Severe sleep apnea is 40 breathing interruptions per hour or more. Normal is 5 or less. So I highly recommend that if anyone is thinking they may, or if your spouse hears you snoring, that doesn't mean you have sleep apnea, but I would get it checked out. I really would. I'd get a sleep study, and don't let them have you do your sleep study on your own at home. That's a bunch of you-know-what. You know, you have insurance for a reason, but they want you to do a sleep study at home. Just a man saying, "Oh, I'm going in the lab or the hospital, wherever," because that's going to be a much more accurate test. The insurance companies like for you to do it at home because it's not as expensive. But I would fight for that. Okay. So, will it limit your sleeping positions? Absolutely. I mean, I'm not a stomach sleeper, and if I was, I would have a really tough time. And some people have a full face mask, some people have just the ones that go in the nose, so it does vary. But if you have, I think that really the take-home thing with this is, if you know you have sleep apnea, use your CPAP. I know there's other ways that you can control it, but I don't know, it just makes sense because I don't want to stop breathing that many times an hour because I know what it's doing to my brain. And that's partially why I was waking up so tired all the time, even if I was getting 6, 7, 8 hours. So, you don't have sleep apnea, do you? I didn't when I was his age either. Jerk.
Just a baby, that doesn't like.
Yeah, he is a baby. I don't have that anymore, so, all right. Okay, so there's not one best sleeping position. We wanted to show you guys a couple options of how you could do it, but there's truly not just one answer here. If someone says you have to sleep on your side, that's not true. You don't have to, but you definitely need to use pillows and get yourself positioned so you're being kind to your spine. Practice good sleep hygiene, good sleeping habits. Trying to go to bed at the same time each night, trying not to drink too much caffeine after whatever time, trying not to drink too much water the last hour you're up, those kinds of things. And we see this all the time that patients we treat that have chronic pain, this is one of the questions I always ask, like how much sleep do you get in a night? And well, the pain will oftentimes interrupt their sleep, which is just making the chronic pain cycle even worse. So we really want to try to sleep in as good a position as we possibly can. Zach, anything else?
No, and it is definitely variable. And if you have, like, say, a surgery or like pain in a certain body part, if you actually give it support throughout the night, maybe it won't wake you up as much throughout the night. And it can change throughout your life on if you have an injury, a surgery, something changes where you change how you sleep.
Stress,
Yeah, stress.
all that. So, all right. Well, we wanted to answer questions. Any question you have, ask Zach. Yes, ma'am.
What do you do for acid reflux?
What do I do for, what would we say for acid reflux?
Having your head elevated should help.
Like maybe sleeping on a wedge?
Sleeping on a wedge is helpful. Laying flat is the worst usually for that, but sleeping with at least your like torso and head elevated can help.
Do you sleep on a wedge?
Yes, but I have to double the pillow besides, or I keep slipping down.
Oh,
So
yeah.
I sleep on a wedge plus a doubled over pillow.
And if you do, have you ever tried on the wedge having your legs supported, like how he did when he was laying on his, when you were on your back? Because that could help make it where you don't slide down.
But they said it's not good to sleep on your side for acid reflux because
Yeah.
it runs into your lungs.
Yeah.
Yeah.
Yeah, they make, you can go online, go on Amazon, there's so many different wedges and pillows, and there's a million different and a million different kind of beds. So my advice on beds is I would err on the side of being more firm than being too soft. I would definitely, if you're going to buy a new bed, I would make sure that you could return it within a month if you weren't happy. And it definitely would say to rotate that mattress, because if you don't do that after 6, 9 months or a year, you should pull your sheets off. When you should get down and look at that. And it's sometimes amazing. So your spine has no support at all when you're doing that. Questions? Yes, ma'am.
Do we have a mic or do I need to holler?
Yeah, you want to just, yeah.
Before my question, I wanted to address the acid reflux thing. If you lie on your left side, because of the way the digestive tract works, you will have less burning than lying on your back or on your right side.
Oh. Very
And then
good.
my question was, Zach said, get a new pillow when yours is worn out. How do you know when your pillow's worn out?
Well, I would say it depends on the type of pillow. Like with a memory foam one, if you're not getting the same amount of support and it's not keeping your head in the proper alignment, like you start feeling like it's falling back more, you're side sleep when you are in more of this position than you used to be, then it's probably time to get a new one. If you have more of like, these are like the softer feel pillows, those I feel like you can notice when they start caving in a little bit and they're losing some of the like feathers or support in the middle of the pillow. And just when they start to lose like the integrity of the pillow.
Yeah, I don't know.
I don't know exact time frames because I feel like pillows vary so much on how well made they are and how long they last.
Yeah, I don't know. I would probably say every year you should be probably looking at new pillows. I mean, if you're sleeping on it every night, it's going to really flatten out. I mean, I know that I got a new pillow about 4 months ago. It's hard because you go to Kohl's to look at pillows and it's so overwhelming because there's 1,000 pillows there. You don't know what to get. So I got one. And at first, I thought that this was great, but what it was doing with me was giving me no support. So I was thinking, and my head was slowly starting to extend back, which when you have sleep apnea, that's not good either. So it was making my sleeping definitely worse. And so I got a different type of pillow. It's more of like a memory foam, a little bit more firm. And then my sleeping pattern improved immediately because I wasn't tipping back into extension. Yeah. And if you have something to really think about, if you have what we call a forward head posture, which is probably 99% of us to a certain extent, and that's where the head starts to go forward, and you are laying flat, you may need 2 pillows to support your head. Because one, you may be hanging out in space there. I see this a lot in the clinic. That's one thing we work on is trying to release some of the muscle tension so your head can drop back. But some people, I have to put 2 pillows underneath them, so maybe they're not in neutral, but it's their neutral until we can improve it. Yeah. Yes, sir.
Could you talk a little bit about melatonin, the possibility of addiction, the dosage rates, frequency of taking it, and so on?
So the question is about melatonin, dosage, frequency, all that. I'm not going to comment on it because that per se isn't our specialty, but I know a lot of people take it. I know a lot of people don't. I think that you have strong feelings on it.
Not really. I've never used it and don't want to.
I personally think before you should take something like that to help with sleeping, like I would make sure all the stuff we talked about is kind of in order. And if you've got a good bed and you've got a good pillow and you've got good sleeping hygiene and you're doing the things you should and you're not being on your computer till the minute you go to bed or not on your phone, that's something else we could talk an hour about. But I think if you're doing all of that and you're still not sleeping good, obviously I would contact your physician to see if medically is there something else going on. If there's not, then my feeling is okay, let's try it. I don't know how much you should take. I don't believe it's an addictive drug. But then again, I don't, that's not kind of our world. But try to do what we've done, what we've talked about first, and then contact your physician if the sleep still isn't good. I mean, we see people that are on 30 different medications, and why add one more? Even though I know that's not prescription, I know it's over the counter, but why? I mean, my feeling is that most people in this world, especially as we age, are probably over medicated, probably, and. We see lists coming in of 30 different meds. So, and sometimes they just get added on, and you got to make sure that your primary care physician is sitting down with you to say, hey, is there anything we can drop off? That's just my feeling. Next question. Yes, ma'am.
Is there any exercises for leg pain that would help with, I have a lot of trouble at night with the legs, and today I don't, and when I'm up and around I have no problem.
Yeah.
I rub and that does nothing.
Yeah, so is there any exercise for to help prevent or to decrease leg pain at night? Kind of like a restless leg syndrome or something like that? Well, whenever anyone asks me a question like that, I would say, well, we have to evaluate you first. I don't want to sidestep your question, but there could be a multitude of things going on. There could be a lower back issue that may be because you have all these nerves that come out of your lower back, and if for some reason, if they're irritated or if your sleeping is maybe causing a little bit of irritation to those nerves, you'll start to get that type of sensation in your legs. Perhaps there's a neuropathy going on. I mean, there's a really wide array of things. How do you sleep? On your back or your side? On your side? Okay. Do you use a pillow in between your knees?
I get small pillow, not that size.
Small pillow?
Yeah.
Okay. Okay. And you said you don't have it every night, or you?
No, not every night, but
Okay.
too much.
Yeah. And just you don't have the pain like when you're up and moving around?
No,
Yeah.
but I do have back problems, but
Yeah.
your friend Sam helped me
Oh, good.
immensely.
Good, good. So oftentimes obviously there can be like what we call idiopathic neuropathy, which is neuropathy that no one can give you a reason for. But there can obviously be a multitude of back issues that can give people symptoms in their leg, whether they're laying down or, when we're sleeping, the thing is that our bodies like movement. I tell people this all the time, but cartilage in your body, whether it's your discs in your back or your knee cartilage, there's no blood supply to it. So the only way to keep it healthy is movement. And as all of us age or if we have injuries, the body really needs that movement to keep the cartilage healthy. Well, when we're sleeping, we're not moving. So, I mean, that could be part of it, but yeah. Have you ever talked to your physician about that?
Yeah, they don't seem to have any help.
No.
Lots of times.
Yeah. Yeah. And the other thing is, I'm not here to promote any service, but I'm here to educate you guys. But in the outpatient clinic, we have this device called the Newbie, which is tremendous for nerve pain. So we talked about that last time that Zack and I were here back in June, and that's helped a multitude of people with different pain, but including leg pain. Okay? Next question. Anything else? Yes, ma'am.
Do you have any comments on sleep by number beds?
Sleep by number beds. Wow, I get asked that question a lot. How much are they? They're pretty expensive, aren't they?
Yes.
Who has one? Okay. You like it?
Yes.
Yeah. I think most people that have one really enjoy it. I've never slept on one. But I definitely know that the people that have them like them. But I don't know what the lifespan is. I think one person told me 20 years.
That's mine is
Yours is 20 years old?
20 years.
Wow.
You don't have to turn them over either.
Right, yeah. It's hard for me to imagine any mattress making it for 20 years, but that's what they say that it lasts that long. I don't know. Why, are you thinking about buying one?
I've got one already, so,
Do you like it?
yeah, I think so. I don't sleep well, though.
You don't sleep well?
I don't know if it's the bed or,
Well, have you slept better since you bought it?
no.
Oh, that's not good for a commercial.
I just mean, instead of having pillows, you can have it, where you see it.
Sure, yeah. I mean, you can obviously adjust the height and the legs and all that, so that's, yeah.
Yeah, that part would be easier.
Yeah, that would for sure be easier. I don't know, last fall we got a new mattress. It was $2,000 and I love it. But I know there's a whole range of prices out there. Do they give you can you try it out for a month, and if you don't like it?
I think so, yeah.
Yeah. Okay. Okay, any other sleeping questions? Yes, ma'am.
When you say rotate a mattress, mattresses today weigh a ton. So what constitutes rotating?
Well, when that happens, you call Zack, and he's here all the time, so he'll be more than happy to rotate it for you. Because most of the time you can't flip it. They used to say flip it, but most of them you can't flip anymore. So just
Just spinning it.
1/4 turn? Is that a rotation?
You have to do a full turn because the length and width are different.
gotta do a full turn.
The bedrooms here are not big enough with the furniture to do that.
See this strong man right here? He has no sleep apnea. He sleeps great. No mask at night.
Just a baby screaming.
Just only a baby, but he sleeps so good he probably ignores it. Yes, but that is super important. And next time you change your bedding, just look at the mattress. Try to get down and look at it and see, and you should be able to like put a ruler across it and be straight across, and no gap in between the ruler and the mattress. But you look for that gap. That's super important. Any other questions for us? Well, if you think of any, our cards are back there. There's our contact information. You can call us, text us, smoke bomb us, however you want to communicate. But enjoyed talking to you guys as always. All right, thank you.
Thank you.